Fiona to explain more.
Thanks, Landon. And we are, as Landon mentioned, we're going to be talking about a study that we did looking at the impacts of COVID-19 on people experiencing homelessness. Throughout this presentation, feel free to jump in and ask questions or whatnot. We really want it to be engaging, but we want to tell you a little bit more about the study itself. So throughout the presentation, we'll talk a little bit more about the study itself, how we collected data, what was learned, and then we'll have a little bit of a discussion and tell you some more about some upcoming events that we have going on. So just as a warning, some of the subject material in this presentation may be emotionally challenging due to the nature of what is discussed. So I just wanted to give everybody a heads up about that. And then also to note, the pictures that you see throughout this presentation were taken by the actual co-researchers or people experiencing homelessness. And I'll explain a little bit more about the use of the term co-researchers as we dive into the presentation. So a little bit about the study. This study specifically wanted to look at the challenges and opportunities that people experiencing homelessness faced during the COVID-19 pandemic in South Santa Barbara County. We used a particular research technique called PhotoVoice, and this particular technique uses photography to understand a phenomenon. It really is meant to capture the perspective or experiences from those individuals that are most affected. And the individuals that are present throughout the study or are participants throughout the study, because they're so involved in many portions of the study with the data collection, with also the types of data that we are able to get, we refer to these individuals as co-researchers. So Landon and I will utilize this nomenclature throughout the rest of the study. So data collection for this particular study took place from August 24th to, May 24th to August 12th. And as Landon mentioned, we partnered, me being part of the Cottage Center for Population Health, we partnered with SB Act as well as Vertical Change to conduct this study. The study comprised of 13 focus groups, as well as also one-on-one discussions with our co-researchers. We were fortunate to be able to collect data from 3 different homelessness communities. We had some individuals from a sheltered community, individuals from unsheltered, and then a vehicular group as well that participated. So throughout the study, we had various encounter points. Our first encounter with our co-researchers involved the distribution of the disposable cameras to each individual that was taking part in the study. And at this encounter, we also, as part of the research team, trained our co-researchers on how to utilize the particular disposable camera. We also told them a little bit more about the study, of course, and got their consent to be able to participate in the study. The second encounter with our co-researchers was where we picked up the particular disposable camera from the co-researchers. We then developed these photos to really see what exactly the co-researchers captured. What information did they get representing their challenges and opportunities due to the COVID-19 pandemic. When we developed these photos, we also reviewed the photos to make sure that the photos did not depict any illicit activities or include any illegal activities, or also include children under the age of 18. And then our last encounter with the co-researchers, this is where we conducted focus groups to really understand what the particular photographs that were taken by the co-researchers meant. So we used a particular facilitation technique called SHOED, where we asked the co-researchers what exactly did they see in this picture, and we asked them to give us a little bit more background about each of the photographs. So for the study, we had a sample size of 38 individuals. It was predominantly male, with 26 males participating in the study, and that was about 68%. The ethnicity or the makeup of the particular ethnic groups and race, it was predominantly non-Hispanic white, with 36 individuals making up that group, or about 95%. And then a majority of the individuals specifically were white for the race category, with 29 individuals, which was about 76%. For the current living arrangements for the study individuals, they covered a breadth of different areas. More specifically, we had a non-congregate shelter group with about 8 individuals, sheltered group with 7 individuals, and then primarily dwindled down to the unsheltered, vehicular, and then former cottage recuperative care patients, which comprised of 11, 10, and 8 respectively. So to talk about what we learned, I'll pass it on to Landon.
So I'm going to share some of the findings more broadly, and then we'll dive deeply into each one with some quotes from the co-researchers to go along with the photos that they took. So just to start with, the first finding was, I think, something we all might expect, that the change in resource availability during the pandemic drastically impacted co-researchers' access to basic needs. Number 2 was that co-researchers stated that the perceptions of homelessness were more negative during the pandemic, and they felt a general sense of disconnection from the rest of the community. Number 3 was that the co-researchers navigated both challenges and opportunities. The pandemic afforded some really unique resources that didn't exist before the pandemic, but also obviously presented a set of new challenges to go with that. And then number 4, we got some really helpful recommendations from the researchers moving forward. So let's start with the basic needs, that first finding. And again, just to reiterate what Fiona said, that when we talk about co-researchers, we're talking about the people who had experienced homelessness during the pandemic, who participated in the study. They were co-researchers in this project. This individual said, before the pandemic, I used to go to the library daily to charge my stuff, read, and then when that shut down, initially it was supposed to be just a couple of weeks, and then it turned into 15 months. So that kind of drastically changed my routine, and then the routine of a lot of people not being able to go there. We heard this sentiment from a couple of different individuals. If you go to the next slide, this individual said probably the biggest hurdle that came up with electricity was that the library had to be shut, and the library was literally the main place that everybody who doesn't have access to electricity or to electronics, because people can't get jobs if they don't do applications. The iPads and the phones will not process applications. You have to have a regular computer. And the only place that we had any access to that was the library. So we heard from some individuals that they just didn't have this access at all. We had several photographs of restrooms that were shut or locked at the local public parks. We heard from individuals about how restaurant bathrooms were also closed to them and they weren't able to get access. We heard about individuals not being able to access hot water so that they could make tea or soup for a meal, especially if they were feeling sick. So there were quite a few basic needs that became much more difficult in this time. As far as negative perceptions of homelessness, we heard several different stories from individuals who felt stigmatized specifically during the pandemic. This individual participated in the non-congregate shelter at one of the motels, and they said, we get to the motel and I'm so grateful for the motel. And I say, oh yeah, a pool. I'm supposed to swim for my hip and back. Oh, that's not for you people. They don't understand how those things hurt. And I know they don't mean to say that. They just can't see it from our point of view. There's no way you can unless you're there. And if we keep going to the next slide, coinciding with this was a sense of disconnection. This individual said during the pandemic, it was more or less like an isolation type thing. Being segregated and being homeless, people were so scared of contacting COVID-19, they were actually just distancing, not giving money and helping, not giving you any food or anything like that. We heard from several individuals that they felt like community members would walk further away from them if they saw an individual experiencing homelessness, or if they saw someone sleeping in their vehicle, they would kind of steer away from them. And the sense that the people experiencing homelessness got was that they were perceived as carriers of COVID-19. Or just as dirty or unhygienic. As it comes to navigating the challenges of the pandemic, this individual said, I had to do laundry like in buckets. I couldn't even take it to the laundromat, so even that was difficult to do, especially on the street. I didn't have a place to do it. But luckily, I had my friend here who let me use his water, and I hung my clothes on the fence, so I was able to have clean clothes again. Others talked about the challenges of being able to attend like medical appointments on Zoom and having to sign up for those and having to learn the technology for that. Others said that access to those appointments were just limited in general. Others talked about having loved ones in the hospital or sick during that time and being unable to visit them, including some who passed away. And then on the flip side of this were the opportunities that arose during the pandemic. This individual said, there's nobody in this park, probably due to the pandemic, not sure, but it was a safe place to hang out at. I didn't have to worry about anybody coming by me, or, you know, I could sit at the table, do my thing, and not worry about catching the pandemic because there's no one around me. So I felt very safe here and relaxed. We heard this sentiment from a couple different co-researchers who said that they loved being able to just spread out in the parks. They loved that they were left alone, both by community members and by law enforcement during this time. Others talked about the benefits of receiving stimulus package funds or getting to stay in the non-congregate shelter and how transformative that was for them. So there were quite a few bonuses that came out of this time. In terms of recommendations for change, this individual said, water is life. Having free access to it is really important. I think we should have more access to free water and infrastructure of water and communication. Sanitation should be open like 24/7, 365, you know, and that would help us keep us cleaner and safer across the board. If you go to the next slide, I'll read another. We're going to go into more depth of these recommendations in a minute. This individual said, I think as a community, we can learn that, you know, hey, we all know how scary this whole thing has been. This has freaked out everybody. It's affected everybody. We get that, but people, always we need to pay attention to the people on the fringes of society, always, but especially during these times. And so because we got so many helpful recommendations from the co-researchers, we wanted to break those down a little bit just to share with you from them what they would suggest for future crisis situations. We realize that we live in an era where crises are just normal. We have fires, we have floods, debris flows, we have pandemics. So we know that there will be crises in the future. And so we want to take these recommendations seriously as we consider how we support our populations experiencing homelessness during these times of challenge. So you can go to the next slide. Number one was that need for uninterrupted access to resources. So we heard that there need to be hubs or places that individuals experiencing homelessness can know that I will always be able to get resources no matter what's happening, or I will always be able to call this number to get information about what's happening, or I'll be able to know if there's a flood planned for tonight or whether the fires are spreading. There was a general sense that a lot of people experiencing homelessness weren't aware of where they could get information or where they could get resources because things were in flux during the pandemic. Number two, the impact of messaging on those experiencing homelessness in times of crisis. We heard from co-researchers several times about this sense of being scapegoated. That I think I mentioned earlier that people experiencing homelessness might be carriers of COVID. And so they suggested we need more positive messaging, that we should be looking out for each other during this time, that there isn't one people group that is going to be more dangerous than another, and that if anything, we need to be more supportive during this time. Number three, the potential exists in community relationships. This dovetails nicely with that communication comment. We heard from co-researchers that they would love to have better relationships with some of our local leaders, whether those are elected leaders or leaders of service providing organizations or law enforcement agencies, specifically so that we can address stigma and be proactive in communicating the actual needs of some of our most vulnerable community members. They expressed that having those relationships might help to just change how decisions are made in those times of crisis. Number four, the importance of maintaining the opportunities that resulted from the COVID-19 pandemic. So we talked about a few of the opportunities that came up, and the co-researchers said, are there ways that we could keep some of these things going? The motels, for example, and we've gotten to see the Home Key project that the state of California has implemented as a continuation. And in addition to that, we heard about grocery stores allowing people to access more of the expired food than they normally would be able to, and other restaurants or grocery stores that allowed people to sit or remain in their patio space when no one was there, in a way that they wouldn't have allowed during other times of the pandemic. So we heard from the co-researchers, there were a lot of really helpful people in the community who really did look out for people experiencing homelessness, and how can we continue that spirit on even after the sense of crisis is diminished. Number 5 is to seek input from those with lived experience. We talked about this a little bit when we're talking about building relationships with local leaders, but the co-researchers said that they felt that they really weren't considered in a lot of ways until later on in the pandemic. And so they invited all of those who are local decision makers, again, at all different levels, to really enter into relationship with more people who are experiencing homelessness, so that when the crisis situation arises, they will be at the forefront of the minds of the people who are making the decisions about what we do and how we handle the crisis. And I'm going to end this section with a quote. Make them more aware that there are people that are suffering. Bring to light that, hey, this is a person that needs help. And if you can't see that because of whatever reason, your own judgment or your belief, they can be helped. All they need is, I always say, a hand up and a boot down. It seems like most people just want to be listened to. They just want to be heard. And then I want to go to, just before we talk about, we will be doing more presentations around this, including a full photo exhibit, but I want to open it up for any discussion or questions or comments. I see a question in the chat about whether the city has considered opening bathrooms longer hours. Most of the county parks I frequent don't have restrooms, but city parks do, and they typically aren't open when I walk by. I don't know, Joao, if that's something you're able to speak to about how the public restroom hours have changed since the pandemic restrictions have lifted.
Sorry, Landon, I missed that. Can you say that again?
No, that's okay. We had a question in the chat about whether public restroom hours have been expanded, especially since the pandemic has ended. Or pandemic restrictions have ended.
That's outside my department. I don't know that answer. Most public bathrooms are through parks and rec, and they would know that. So I apologize.
No, that's okay. I think this is an ongoing community question we hear is, where are the public restrooms? We need more public restrooms. And so it's a sentiment that I've heard echoed, not just from the co-researchers, but also from some community members in these meetings. Other questions or thoughts? To those who work with people experiencing homelessness on this call, is anything here surprising to you, or do these resonate with what you saw during the pandemic period? Yeah, Lucille.
Thanks. I think we've seen this just over the past couple weeks, and our county homeless team talked about. We're like, none of this is surprising. This is what we all experienced, what we all witnessed, and really struggled with. So it was nice to see it, that it was aligned with what we had experienced and what we saw and we're trying to respond to just over the past couple of years. So I appreciated having that like neutral party, basically.
Landon, you're on mute.
If there's no other, thank you. If there's no other comments or questions, pass it to Fiona to talk about what's coming up.
Thanks, Landon. Yeah, we have a couple of things coming up that we're really excited about. In doing this project, it was really a joy to work with the co-researchers and to be able to capture their voices in a way in which was non-traditional, and they typically don't get a chance to gain access to these types of modes of communication. So one of the things that the co-researchers shared with us when we asked them how would they like their stories to be shared, how would they like this information to be disseminated, they shared with us that they would really enjoy having a photo exhibit put on in a public place where we could display all of their photos. So in order to honor that promise to the co-researchers, we are going to put on a photo exhibit on May 9th at the Santa Barbara Public Library. It's going to be in conjunction with another panel meeting folks where they're at. It's a book to action series that the SB Public Library is doing. And so we're going to join that particular panel there on May 9th. And the times for that photo exhibit are going to be from 6 p.m. to 7:30. Also at the SB Public Library, we're going to have a month-long photo exhibit where we're going to display the 28 photos that the co-researchers took throughout this particular study. And there's various themes and captions that are associated with these photos. We're going to display those photos in a display case in the public library. That display case, I believe, is located when you first walk into the library, I think over to the right. So because the display case is a little bit smaller, we can't display all of the photos at one time, but we'll be rotating those photos out throughout the entire month of May. So if you do get a chance to stop by, we would love to see you. And then lastly, we're going to continue to give this presentation to additional local meetings with elected officials throughout the month of April, and then hopefully continue to work our way down. So those are some upcoming events. Anyone have any questions or some additional thoughts?
I'll add to that. We have shared the findings with some of the co-researchers who participated in the study. And one of the reasons why we added sort of the trigger warning at the beginning of the PowerPoint was that it was overwhelming for them to look back and remember how difficult the period was for them. And they said, I can't remember how they phrased it, but they said something to the effect of like, you guys will just see a PowerPoint, but to us who lived it, it totally feels different. And so we came away from that saying, how do we make this a little bit more encompassing so that people who come and see the photos can really experience it a little more fully, even though we can't fully experience it. And so the Cottage design department, marketing department has been helping to design these photo exhibits to be a little bit more immersive. So we really encourage you to come check it out. I think it'll be a powerful experience of just getting to see all these photos and hear some of the words of the co-researchers.
And then we would be remiss if we didn't acknowledge some additional support that we received from this. Julia Petrus actually was the brainchild behind this particular research study. She used to work at Cottage and got this study through the IRB process and was able to do that. And then I came on to execute the study. And then we also were able to receive funding from the Cottage Center for Population Health, as well as the Cottage Health Research Institute. And a number of different volunteers worked on this project to be able to allow us to collect the data and, present these findings to you here. So I want to acknowledge those research volunteers, as well as the different service agencies, shelters, and the safe parking program that we were able to partner with. Primarily, Landon was able to make those connections and help with that. So really want to say a shout out to those individuals and that funding. And research does take a village, so we're very appreciative of all the help and support that we were able to get. And then lastly, we were able to write a full report on these findings and go into a little bit more detail about the additional findings that we found. And this particular report is posted on the Cottage Center for Population Health website. Here is the link here, and I believe Landon will also put the link in the chat if you are curious about any additional things that took place in the study or want to read a little bit more about the findings. Feel free to access the full report using that link. Yeah, Deborah.
Hi, thanks. That was both interesting and really touching. That was just a beautiful, beautiful project. I really want to bring some people to the library to see that first part of it on May 9th. And since this is 2 weeks before, I know I'll forget about it in the plethora of other paperwork. How is this going to be advertised? Will it run in the Independent or something? I'd like to also give it to the churches that serve in the parks on Thursdays. I think a lot of those churches would like to, their participants would like to come and see this too.
Yeah, thank you for that. To that, I say the more the merrier. We would love for as many people to come out as possible. We'd really appreciate that. As far as advertising, I don't know, Landon, have we thought about that really? No.
Yeah, we'll be sending out, we have a flyer for the events
That's
that we'll be
great.
sending out to all of our all call wrap lists, and I'll make sure you're on there, Debbie.
Thank you.
And then we'll be, we're hoping, yeah, we'll be posting it widely.
Yeah, once again, my hat's off to you. This was really uplifting. And I can feel empathetically how it must have been for the co-researchers that were able to participate. It must have been really wonderful and also painful for them.
Yeah, thank you so much for your comments and your kind words. Really appreciate it.
I had one other question in the chat. Someone was asking whether the co-researchers were compensated. They were. We really this year have been seeing in so many ways how important it is to make sure we're paying people for their expertise. So the people who participated in the study received both gift card stipends as well as COVID hygiene kits. All right, with that, I think we'll turn to our next presentation.